Hi, my name is Bushera and I'm going to be talking about Ramadan and the coronavirus. Evidence is emerging how communities from the Black, Asian and minority ethnic communities are being disproportionately affected by the coronavirus, despite making up only 14% of the population of the UK. And I'm going to talk through a few things that we can do to try and optimise our health and avoid the coronavirus affecting more of our communities. If you have symptoms of the coronavirus during Ramadan, it is important that you do not fast. You can make up the fast afterwards. It is important that you remain well hydrated and take regular paracetamol to control your fever and stay well. You should only break your fast with the people that you live with. Do not have guests for iftar and do not mix households. During Ramadan, you should only pray with the people that you live with. It is important that you do not mix households and do not have guests to pray Tarawih. You should not share prayer mats or prayer beads. Use this opportunity to quit smoking. Smoking is associated with ill health and worse outcomes with the coronavirus. If you have diabetes, heart disease or high blood pressure, it is important that you take your medication and also optimise your health conditions as best as you can by monitoring your diet and also exercise. During Ramadan, we all like to be generous and give food. However, we need to be mindful of the further spread of the coronavirus. If you are going to give food, be mindful of three main principles. Number one, place the food in a container which can be sealed, such as a plastic tub. When you drop off the food, place it on the doorstep, ring the doorbell and stand back at least 2 meters. The person who is receiving the food should take the container and disinfect it and also wash their hands. If gifting food, make sure it is in sealed, unopened packets which can be cleaned, or food which can be reheated, food which can be peeled or washed. Remember, if you have any symptoms of the coronavirus, you should not be packaging food. And if you have an upset tummy, namely vomiting or diarrhea, you should also not be packaging or handling the food. That the coronavirus can survive for up to 24 hours on paper and up to 72 hours on plastic and metal, so be mindful of this. While wearing a mask, it's important that you put it on properly. The bendy bit at the top goes over the bridge of the nose, and then you take the ties to the back of the head and tie it in a bow, as you would tie a shoelace. Take the bottom end of the mask and take it under the chin, and again tie it in a bow like you would shoelaces. It is important to not keep touching the mask. Keep your hands away from the mask for the whole duration of wearing it. When you come to remove the mask, take the ties from the back and pull on one. Removing the mask, pull the ties and throw the mask away. Please remember to keep washing your hands and have a safe and healthy Ramadan.